Let's talk about traumatic brain injury. Subscribe, like, and share so you can receive notifications for future videos. During this presentation, we will talk about the definition, causes, prevention, prevalence, and educational considerations. Let's start with the definition. Traumatic brain injury is defined by the Individuals with Disabilities Act as an acquired injury to the brain caused by an external physical force resulting in total or partial functional disability or psychosocial impairment, or both, that adversely affects a child's educational performance. So what are some of the causes? Here are some of the common events causing traumatic brain injury. The most common are falls from a bed, ladder, downstairs, or in the bath. Next, we have vehicle-related collisions. Explosive blasts and other combat injuries. A couple other causes of traumatic brain syndrome are a violent hit or shake to the head or body. This can happen in sports such as American football, soccer, football, rugby, baseball, or any other contact sport. There's also shaken baby syndrome, where a child is shaken with such force that their brain sustains damage from moving around in their head. If an object goes through the brain tissue, such as in a stabbing or a gunshot wound, this can also cause traumatic brain injury. Who is at the most risk of sustaining a traumatic brain injury? Children ages 0 to 4 still have soft skulls, so if they fall or hit their head too hard, they're more likely to have brain damage. Young adults ages 15 to 24 are a bit more rambunctious and enjoy playing physical sports and doing things that could cause a traumatic brain injury. Senior citizens ages 60 and up are at risk of falling and hurting their hip, or falling and also hitting their head. And then we have males who tend to just be a little more outgoing and do things that are a little more at risk than females. Now let's look at some of the dreaded complications of traumatic brain injury. Depending on the severity of the traumatic brain injury, a state of altered consciousness can occur. There are different types of altered consciousness, including coma, a vegetative state, minimally conscious state, or brain death. There's also physical complications such as seizures, brain buildup in the brain, blood vessel damage, headaches, and vertigo. Let's take a look at some of the intellectual problems that can occur. There can be attention or concentration issues, judgment issues. There can be impairment to reasoning, learning, and memory. Executive functioning can also be impaired. Areas of executive functioning include problem solving, multitasking, organization, planning, decision making, and beginning or completing tasks. There can also be problems with communication. Some of the general problems related to communication may include difficulty understanding speech or writing, difficulty speaking or writing, an inability to organize thoughts and ideas, and trouble following in conversations. There can also be some behavioral changes. Behavioral changes include difficulty with self-control, a lack of awareness of abilities, risky behavior, difficulty in social situations, and verbal or physical outbursts. In addition to intellectual problems, there may be emotional changes, sensory problems, or degenerative brain diseases. So what can we do to prevent traumatic brain injury from occurring? First and foremost, seat belts are of the utmost importance. Be sure to always wear your seatbelt correctly and make sure the airbags are functioning. The second tip is to always wear a helmet if you're riding a bike, if you're riding a motorcycle, if you're on skates or a skateboard. Any potential of falling and hitting your head, make sure you have on a helmet. Number 3, pay attention to surroundings. When you're walking around on the sidewalk, in the park, at the mall, put the phone away. Make sure you're paying attention to where you're going. There could be a pothole in the street. There could be a curb that you trip over. Just make sure you're paying attention. Number 4, try to prevent falls. So in the bathroom, for instance, use a slip-free mat. In the kitchen, try to use mats that are for preventing falls. And also make sure that your showers have those sticky floor cushions at the bottom to keep you from slipping when the water is running on the bottom of the bathtub. You can also have handrails to help you get up and down or in and out of the bathtub. Number 5, prevent head injuries in children. Be sure to make sure children's heads are protected with helmets, or that they also are holding someone's hand if they're still learning to walk. If they're starting to graze and roam around the room as early walkers, make sure there's pillows around in case they fall. The number 1 importance to prevent a traumatic brain injury is to protect the brain. We want to always wear helmets when possible and try to avoid hitting our head. How often does traumatic brain injury occur? Well, there's approximately 69 million people worldwide, which is about 1% of the population. Now let's look at a few educational considerations. Some tips to help you when working with children who may have suffered a traumatic brain injury include providing repetition and consistency. Make sure you repeat tasks and stay consistent with instruction. Use explicit language. Try not to use figurative language, but be explicit and concise. Chunk information together to increase memory. The more things you can put together or use various memory strategies such as mnemonics, it will help those with traumatic brain injury remember the information for a longer period of time. Provide rest breaks as needed. Depending on the severity of the injury, the child may need frequent breaks to rest their mind from thinking about the content. And focus to keep the environment as distraction-free as possible. Two more teaching strategies include learn about the child's injury and present needs. The more you know about the injury and what the child needs, the better able you'll be to individualize instruction for the child. Make sure you model new tasks. Those who have suffered a traumatic brain injury may find it hard to take in verbal information, so you want to also show how to complete various tasks. Have consistent routines. Also teach students with traumatic brain injury how to stay organized by using Post-it notes, or maybe they will use some type of graphic organizer or just different ways to know routines. When they can see what's coming up ahead of time, things work out better. Also communicate with the students' parents. Make sure they're constantly aware of the students' strengths and things that they need to work on, as well as what's working at home and what's working at school, so that the two environments can flow together as well as possible. And the most important is be patient. Let's skip over a bit to assistive technology. So you want to use calendar boards, or as mentioned previously, Post-it notes, or anything that can help the student become organized and follow through on tasks. You could also use voice organizers to reduce written work. Smartphones have a plethora of apps and different devices and techniques and technology that can help with a person who has a traumatic brain injury. There's also really cool watches that can help along with the smartphones to set alarms or to read out messages to the child or various other cool things. And there's also PDA devices. In terms of more specific to the classroom, you could use speech recognition software such as speech to text or text to speech. You may need to have the child write a story, so maybe they speak to the computer and the computer writes for them, or maybe they need to have a book read to them, and then you would use text to speech. You could also use screen reading software or tinted overlays for reading. Sometimes the glaring white paper causes a negative effect for those who have had a traumatic brain injury. You may need to use a different color overlay or different colored paper to ease the visual perspective of a child who has a traumatic brain injury. And finally, for assistive technology, this may not sound like technology, but the use of canes, crutches, wheelchairs, or specialized furniture could be very important depending on the severity of the injury. They may need help with mobility, and that is a form of technology. In reference to the individualized education plan, be sure to include accommodations and, if needed, modifications for a child who has suffered a traumatic brain injury. Some accommodations include extended time, written instructions, check for understanding, frequent breaks, preferential seating to reduce distractions, and color-coded materials. These are just a few examples. There are also several more. In terms of modifications, you can reduce workload, simplify the content, have alternative assessments, use alternative grading criteria, or lower the reading level. Now remember, accommodations change the presentation of the assignment, but not the level of difficulty. Modifications, on the other hand, actually modify or change the assignments or assessments so that the level isn't as rigorous. Moving on to related services, which are also listed in the IEP, a student with a traumatic brain injury may need an occupational therapist, a physical therapist, perhaps a speech and language therapist, a social worker, or a vocational counselor. Here are some of the resources used in today's presentation. And thank you for learning all about traumatic brain injury.